I'm not a Superman, but I owe a lot to Dr. Riad Fakih. He was an integral part of my recovery. I have at least 10 friends who did ACL and meniscus surgeries. None of them have recovered as quickly as I have. الطريقة اللي ساعدني فيها والرجعة اللي قدرت ارجعها على الرياضة اللي أنا بحبها ما حأنسى له هي أبداً.
Well, bless you, Dr. Riad, bless you, CMC. Great stuff, ACL Meniscus. 9 months in the ring sparring, 12 rounds, preparing for a fight in 2 months. Great work, really, great work. Super happy.
So I was actually preparing for a fight, and during my training I had a very bad knee injury. It was extremely painful, and the same night my whole leg was swollen and I couldn't walk. I had to check with the doctor. And I was very pleased actually to know that Dr. Riad is in CMC, and actually CMC has opened in Dubai. So I booked an appointment with Dr. Riad.
Mr. Hisham came to CMC Dubai with an ACL injury and a meniscal injury.
The minute he examined me, the first diagnosis was he told me that I have a complete tear of my ACL and a meniscal injury.
ACL injury can be a debilitating injury. The patient, they lose control of their knee and they have what we call the giveaway sensation. There are several techniques for ACL reconstruction. One of the new techniques is what we call the all-inside technique. When we say all-inside, it means we preserve the bone cortex in the tibia and in the femur. We take one tendon and the recovery is very quick. The patients can ambulate the same day.
I was told that I'm going to need crutches for at least 3 weeks. Dr. Riad insisted that I don't need crutches and I don't need a knee brace, which everybody was telling me that you do. I actually used crutches for 1 day just because I was feeling a little bit not so confident. So I used crutches for 1 day and then I had no need for crutches anymore. I did not wear a knee brace, unlike what people told me. And the most important thing is that I do not have any scar on my knee, and that's something phenomenal. So now if you look at both knees, you wouldn't know that I operated on this knee itself.
They can start activity except for running or jogging or pivot mechanism after 3 weeks, and then they can go back to regular activity after 8 months.
My recovery was phenomenal. Within 6 months I was able to jog, I was able to go back to my training. I play boxing, I'm a professional fighter as well. So I was able to completely go back to my training, which is amazing. And I really loved the fact that Dr. Riad was very transparent with me through day one. And he explained to me that it would take you this much time to go back to training. You need to do 1, 2, and 3.
The worst type of meniscal injury is the bucket handle tear, which will cause locking of the knee. So the patients will present with locking, and the patient tells you, I feel catching of my knee, I cannot straighten my knee, and it locks. The treatment nowadays is not excision of the meniscus because this will put more stress on the joint. So what we do nowadays is repair of the meniscal injury. So we reduce the bucket handle tear of the meniscus and we put stitches. This procedure is done arthroscopically. The patients can go home the same day, and then they can start physical therapy after 3 weeks.
I actually did my physiotherapy here as well. That was, again, an amazing experience. And here I am after doing the surgery. I really wanted to share my thoughts on how did it go, because I was told that it's going to be very challenging and difficult. So many people warned me against the surgery. But I had no option. The minute I injured my leg, I couldn't walk. I used to walk and my knee would feel that it fell from its place. I'm very thankful for Dr. Riad. The whole journey was phenomenal with the hospital.
Dr. Riad, I'm waiting for you. Meet me in the ring.